ABCN American Board of Clinical Neurophysiology Certification Part 2 Generalist. Track ABCN2Gen Exam 1. Which of the following best describes the principle behind EEG? A. Measurement of blood flow to the brain. B. Detection of electrical activity from the brain's cortical neurons. C. Measurement of muscle activity. D. Detection of brain wave frequencies through MRI. Answer B. Explanation: EEG measures electrical activity generated by neurons in the brain, primarily from the cortex. 2. Which of the following is the most commonly used electrode configuration in clinical EEG? A. 10 to 20 system. B. 10 to 30 system. C. 8 to 16 system. D. 16 to 32 system. Answer A. Explanation: the 10 to 20 system is the standard electrode placement method used in EEG recordings for clinical purposes. 3. The amplitude of an EEG signal is most commonly measured in A. Millivolts MV. B. Hertz Hz. C. Ohms Ohm symbol. D. Microvolts V. Answer D. 1/4. ABCN American Board of Clinical Neurophysiology Certification Part 2 Generalist. Track ABCN2Gen Exam 2. Explanation: EEG signals are typically measured in microvolts V, which is 1/1,000,000th of a volt. For doubt, which of the following types of EEG waves are most commonly associated with deep sleep? A. Alpha waves. B. Beta waves. C. Delta waves. D. Theta waves. Answer C. Explanation: delta waves 0.5 Hz are the predominant EEG waves observed during deep sleep. 5. In clinical EEG, what is the significance of an asymmetric pattern of alpha waves? A. Normal in all individuals. B. Indicates potential focal cerebral dysfunction. C. Associated with sleep onset. D. Typically observed in children under 5 years old. Answer B. Explanation: an asymmetric pattern of alpha waves may indicate focal cerebral dysfunction, suggesting possible brain lesions or pathology. Identifying normal and abnormal EEG patterns. 6. Which of the following EEG patterns is most commonly seen in a patient with generalized epilepsy? 2/4. ABCN American Board of Clinical Neurophysiology Certification Part 2 Generalist. Track ABCN2Gen Exam 3. A. Sharp waves. B. Generalized spike and wave discharges. C. Alpha rhythm. D. Theta waves. Answer B. Explanation: generalized spike and wave discharges are characteristic of generalized epilepsy, including absent seizures. 7. In neonates, what is the expected predominant pattern in EEG? A. Alpha waves. B. Beta waves. C. Mixed delta and theta activity. D. High-frequency beta waves. Answer C. Explanation: in neonates, the EEG predominantly shows mixed delta and theta activity, which is a normal pattern for this age group. A. Which abnormal EEG pattern is most commonly associated with the diagnosis of status epilepticus? A. Burst suppression. B. Periodic lateralized epileptiform discharges, PLEDs. C. Generalized spike wave. D. Alpha coma. Answer A. Explanation: burst suppression, characterized by periods of high-voltage bursts, followed by suppression of activity, is commonly seen in status epilepticus. 3/4. ABCN American Board of Clinical Neurophysiology Certification Part 2 Generalist. Track ABCN2Gen Exam 4. 9. Which of the following is a normal variant in an EEG recording of an adult patient? A. Generalized rhythmic theta activity. B. Alpha rhythm with eyes closed. C. Continuous 4 Hz spike wave discharges. D. Rapid spiking in occipital regions. Answer B. Explanation: the alpha rhythm with eyes closed is a normal variant seen in adult EEGs. 10. Which EEG abnormality is commonly associated with a diagnosis of focal seizures? A. Generalized spike in wave. B. Focal slowing or focal sharp waves. C. Alpha asymmetry. D. Excessive beta activity. Answer B. Explanation. Focal slowing or focal sharp waves are common EEG findings in focal seizures, reflecting localized brain dysfunction. Diagnosing neurological conditions, e.g., epilepsy. 11. Which of the following is the hallmark EEG finding in patients with absent seizures? A. Generalized spike in wave discharges at 3 Hz. B. Focal spikes. C. Burst suppression powered by TCPDF. www.tcpdf.org/4